I've done this. You can do this in your house if you just find an open area where you're not going to slam into a table or something, or if you have a backyard, you can do it safely in your backyard without ramming into a tree. Find some open space. What you're going to do is you're going to close your eyes and you're going to spin around, or sorry, you have to leave your eyes open. Leave your eyes open and spin around, counting 20 spins as fast as you can go. And then you're going to try and walk a straight line, like your heel to toe, heel to toe. If you have like a line in your grass or a line in the dirt that's easy to follow, you might want to try that. But otherwise, you're just doing heel to toe, heel to toe. And then you can do it again and stand with your feet together. Tip your head back so that you're looking up into the sky. Close your eyes. Extend both of your hands out and then try and with just your pointer finger touch your nose. You're going to record the results of both of those activities, and then you're going to write this paragraph, add a Bible verse in SLE to be your mini lab. Does everybody understand what we're doing? It says chair spin. We're not going to do the chair spin. You're just going to spin around like you did when you were a kid. We were talking about some of these vocab words. A drug is just any chemical that gets taken to the body that can change the behavior or physiology of the body. Drug abuse is the deliberate use of the chemical for something other than its medicinal purposes. So when anybody uses a medicine besides what it was designed to do, that would be drug abuse. Illegal drugs are chemicals that the government has banned because their effect on the body or brain is dangerous. And that's where I told you right now there's still a big to-do over marijuana, because it's quite obvious that it leaves some effect on the brain and body, because otherwise people who are stoned wouldn't sound like Beavis and Butthead all the time. And we can show that in later life, if you do get stoned a lot, you lose your memory and you have a higher propensity to have dementia, because you've effectively plugged up some of those neural pathways. OTC stands for over-the-counter drugs. That would be like NyQuil or Advil, something that you can buy over the the counter that you don't have to have a doctor's note for. But you can also abuse those as well. If you are taking them outside the requirements and the directions for how you were supposed to use them, that would also constitute drug abuse. So the effects then, once you have drugs in your system, the body can build up a tolerance. So one of the things, like for instance, if you were abusing, say, Advil, number one, taking too much Advil is hard on your liver. That's why there are directions for how much you take, depending on how much you weigh and how often you can have it. But also, if you're taking it all the time, the body will build up a tolerance to that particular chemical, and it won't work as effectively as it did when you weren't taking it all the time, because you need larger and larger doses in order for it to get past the tolerance that you've built up to it. Addiction is a form of, or forms after repeated usage, but with some drugs, like methamphetamine, heroin, speed, as soon as you touch them, they can create an immediate dependence on the body, that now the body craves and wants that chemical so bad that it actually will make you sick and make you feel bad not to have it. And that's what addiction means. When you say somebody's addicted, it means they actually will have a physical reaction. If we take the drug away from them, it will make them sick. Withdrawal is what we call the time of adjustment, when they become sick after missing the chemical. Until we can get them past that addiction, they will be in withdrawal and they will feel horrible and want to get a hold of the drug. An example that I would use that's not technically a drug, but it works similar to a drug in the neural pathways of your brain, is sugar. If you have an addiction to sugar or caffeine, people who drink a lot of coffee have addictions to caffeine, then you could actually have that response when we remove the sugar or the caffeine from your diet. Medical proof. Here is a PET scan image showing you the effects of cocaine on the brain. So you can see the areas of activity where it's lit up in red, and you can see that the person on cocaine is their brain has changed. It's changing the way that the brain fires. So the brain activities is in warm area, the cooler activities are areas that are at rest. And on cocaine, the different parts of the brain are firing, and it's actually kind of putting the rest of the brain to sleep. So the normal person would have good grades and be passing their courses. The other person wouldn't be able to concentrate and pass the third grade test. The strange thing about cocaine is that it makes you think you're smart. It makes you think, you feel like your brain is working so fast and you're the smartest thing ever. which is one of the reasons why businessmen in the 80s, that was a much abused drug by them, because it made them feel like they were doing so much better, but they really weren't. So to people outside themselves, we could tell something was wrong, but they thought they were doing great. That's part of the problem with drugs. So now you do need to know for the test what the different types of drugs are. A stimulant would be something that speeds up the body process. It increases your heart activity, your blood pressure, and your respiration. Examples would be cocaine, methamphetamine, speed. All of those are speeding up the body. A depressant does the exact opposite. It slows down the cerebral nervous system, the central nervous system, and it slows down your reaction. So examples would be alcohol, heroin, and pot. When you take those, they slow you down, and it'll actually slow your reactions. That's why people can't pass a DUI test if they've had alcohol. It slowed them down. Inhalants. This is not as bad now, but when I first started teaching science, inhalants was a huge thing for high schoolers. They're inhaling stuff that's not oxygen. So if they're sucking the carbon dioxide out of cans of whipped cream or something, you're now breathing something that's not oxygen, and you're starving your brain, and it can cause issues. So you definitely want to avoid that. Examples of stuff that you could be doing it to and not realize would be nail polish remover, or you know those really stinky markers when you're using strong markers. If you're doing something like that, you should open your window so that you're getting enough oxygen to make sure that you aren't hurting your brain. Another kind of drug would be a hallucinogen. This makes people see and hear things that are not really happening. Examples would be LSD or PCP. It actually causes the brain to fire, thinking it sees or hears stuff that aren't actually there. And then steroids, we kind of talked about this in one of the other units. It is a synthetic hormone that increases muscle mass and strength, but it can also change your moods. It tends to make people become more easily agitated or violent, and it affects their endocrine glands and organs and will impede the development. So if you were taking testosterone, your body would think that you have too much testosterone, and it would not fully develop the testicles because it thinks that they're already doing too big of a job. Okay, so this is just kind of showing you different kinds of drugs. So marijuana and its short-term effects, it could cause unclear thinking, loss of coordination, increased heart rate. Long-term effects, I was telling you, it causes difficulty with concentration and memory years later, even if you stop taking it. That damage is already done. And then because you're smoking it, it can also cause respiratory disease and lung cancer. This is a picture of what marijuana looks like. It kind of looks like a whole bunch of oregano chopped up. Nicotine, you guys have already heard about. Right now, we actually have more problems with people vaping than regular cigarettes. The vapors are targeting your age group with the names and flavors of their vaping stuff. And the smoke, or I don't know if you want to call it smoke, because it's technically not smoke, but the inhalant factor of the vape does more damage to your lungs than regular cigarettes do. We have had athlete kids who were only 16 years old who were on varsity teams and had been athletic all their life drop dead from problems with vaping. It's kind of sad. Inhalants, this is where I was telling you people sniffing stuff or inhaling stuff that they aren't supposed to. It can cause sleepiness, nausea, headaches, loss of consciousness, and death. This is the big thing. If you are breathing in stuff that is not oxygen, you are starving your brain, and you can, from the very first time you do it, die, because you never know which time the brain's going to freak out because it doesn't have any oxygen. Long term, it damages pretty much every single important organ of your body, and a nice side effect, it causes loss of bladder control. So kids who inhale during high school get to college and are peeing themselves. This is a picture of somebody doing an inhalant. Cocaine, including crack cocaine, is a stimulant. It makes you nervous. It can cause loss of sleep, loss of appetite. They tend to drop a lot of weight and be super skinny, look kind of anorexic. Long-term effects, because of what it's doing to the brain, it causes mental illness. It damages the lining of the nose. It causes an irregular heartbeat, can cause cardiac arrest and liver damage. And then this is kind of a picture of what that looks like. Amphetamines are usually some kind of pill. It's also a stimulant. It causes restlessness, irritability, can also cause a heart attack. Methamphetamine, increased respiration. This is another stimulus. An elevated temperature. It can cause strokes, and it also does cause psychotic behavior. This is the one who, when you watch cops right now, a lot of them are doing methamphetamine. People just call it meth anymore. You'll notice on this TV show, they do seem psychotic. That's how you immediately know that they're looking at somebody who's on meth. And then a hallucinogen. This is a scary one. These things that look like stamps are LSD. So do not ever take anything from somebody who you do not know and put it into your mouth. This is what you do. You take this little stamp thing, you put it in your mouth, and the PCP is actually in the picture and the stamp, and it goes into you. From the first time you take one of these, you could end up with mental illness. You will have hallucinations. It does tend to cause anxiety and panic because you have thoughts and interactions that aren't really grounded in reality, and it's very confusing. Barbiturates are a depressant. It's more like alcohol. It's going to slow you down. That people think it mellows you out. It causes poor coordination, sleeplessness. Although it calms you down, you can't actually fall asleep, and then because you're lacking sleep, you will be irritable and confused, and it can slow you down enough that your heart and your breathing actually stop. Tranquilizers, same kind of thing. Opiates are anything that have an opium or poppy-based drug. When we keep people morphine in the hospital, we're doing it so they have severe pain. We're trying to use the opium to delay the pain information from the extremity to the brain, but it slows everything down. It's a depressant, and so it actually causes constipation, which is one of the reasons why if you've ever had a surgery and you had morphine, they come in all the time asking you whether or not you've gone to the bathroom, and it's because it slows down everything, including your digestive tract. Because it can slow it down, it can actually stop your breathing and your heart, which is why they monitor you in the hospital, which is why you're not supposed to take that at home. So here's just kind of showing you again the different things you can see that's going to cause hives and skin rashes and respiratory breathing and intestinal constipation. The eyes will change, your face could swell up, your voice could change. So all of these are different things that like if you ever watch Cops, you'll see that they recognize these signs and they can try and guess what the person's taking. So long-term effects. Here is the day after you partied at Mardi Gras and you're paying for it. We call that driving the porcelain bus. You're throwing up. This is somebody who had too much alcohol. Alcohol is a poison to the body, which is why it's interesting that people drink it all the time. It is displacing your blood with alcohol, which means something that cannot carry oxygen, so you are starving your brain again. And then it also affects your stomach and your liver, which is why you can get hungover the next day. You'll have a headache, you'll be sick, you're throwing up everywhere. I always think it's interesting that somebody throws up everywhere and is sick as a dog, and the next day turns it around and does it again. It's very strange. And then this is some pictures of what happens after drug abuse. So here's a girl picture in 1998. She gets onto drugs, and here is what the same exact girl, I know you can't believe it, but that is the same exact lady in a mugshot in 2002. And here's a guy who was doing steroids. So here's before he started doing the steroids. Here's after that is the steroids. He's now bigger and stronger muscular-wise, but look what happened to the rest of him. And then here is another person. So you can see that visibly you can tell that there are long-term effects. This was from an ad, but it is a real picture. So here's the girl from her shot when she was in high school, and then here is the very next year. I think that's actually her mugshot when she got arrested for drug abuse. Here is the lovely side effects that can happen to anything that you take orally, any kinds of drugs, if you're vaping, smoking, doing crystal meth, or anything that you smoke. It will affect your mouth, and you can lose your teeth. And then here's somebody who's telling you nicotine also can do that. He used to dip, and if you can see, he actually lost his lower jaw to cancer because having that dip sitting in his lip the whole time actually gave him cancer. This is an exaggeration. Your finger's not going to fall off, but you can tell somebody who's been holding cigarettes a lot because the nicotine actually does kill and stain the tissues that you've been holding the cigarette in all the time. And you figure if it's doing that damage to your fingers, imagine what kind of damage it's doing to your lungs and your bodily organs.